Welcome to the Her Health Podcast, transforming health for women and girls at risk, where we empower women and girls to take charge of their health and well-being. Join us as we shine a spotlight on issues affecting women and girls' health and explore ways to create positive change. Get ready to be inspired and empowered as we discuss health, advocacy, and empowerment for women and girls at risk. Please be advised that this podcast may cover sensitive topics such as gendered violence. We understand that these discussions can be difficult to listen to. If you feel uncomfortable or need support, we encourage you to prioritize your well-being. Consider exploring our other podcasts if these topics are triggering for you. Resources can be found in the description.
Hi, and welcome to the Her Health Podcast. I'm Alexandria Lazochek, a master's student in the Community Health Sciences, specializing in public and population health at the University of Calgary. I also work at the Child Studies Lab, where we focus on research that supports children's lifelong developmental health. In today's episode, we interview Dr. Bonnie J. Kaplan, who discusses the crucial role of nutrition in mental health. Dr. Kaplan highlights the impact of micronutrients such as vitamins and minerals on brain function and mental well-being. She shares the latest scientific evidence on how these nutrients influence mental health and offers practical recommendations for clinicians on how to incorporate this knowledge into their practice. Dr. Bonnie J. Kaplan is a professor emerita in the Cummings School of Medicine at the University of Calgary. Dr. Kaplan's extensive research has explored the biological basis of developmental disorders and mental health, with a particular focus on how nutrition affects brain health. Her groundbreaking work has earned her numerous accolades, including the Dr. Rogers Prize in 2019 and being named one of Canada's 150 difference makers in mental health in 2017. She is also a co-author of The Better Brain, a book that she wrote, which highlights the importance of nutrition in improving mental health. Stay tuned for a fascinating conversation that could change the way we think about nutrition and mental health.
Welcome to the Her Health Podcast. Today's guest, Dr. Bonnie Kaplan, is joining us to talk about nutrition and mental health. And I'm your host, Sarah Yursich. Dr. Kaplan, to begin, can you please tell us a little bit more about yourself and your background?
Sure. Thanks for asking, Sarah. I was born and educated in the U.S., although my mother was Canadian, my father was American, like a lot of people with one foot in each country. And I ended up moving to Canada in 1979 to work in Calgary with the university and the Alberta Children's Hospital Research Institute. So my training was in experimental psychology as well as neuroscience. And that's why, for me, studying nutrition was just logical, because that's basically what makes our brain cells and enables them to work. So that's why I think I was always attracted to nutrition research.
I look forward to learning more about that from you today. Can you start by explaining the connection between nutrition and brain health?
Well, it's the issue of foundation. You have to build your brain cells out of something, and you have to enable them to work and communicate with each other as a result of something, and air is not enough to do it. I mean, oxygen does not feed your brain cells. So nutrition is the foundation of brain health. I'm not saying it's the only thing that's important. Parenting, life's experiences, etc., they're all important. But if it's built on a shaky foundation, it will have less impact than if you have made sure that a child's brain is well developed and well supported nutritionally.
And so there's a link, if you could elaborate that, between our mental health and how and what we eat.
Very much so. Actually, one of the studies I did not present, one of many that I did not present, was an interesting one that my former PhD student, Karen Davison, and I did years ago. She had a large number, I've forgotten, I think it's about 110, as I recall, people who living in the community, coping with serious mood and anxiety disorders. And she asked them to keep track of what they ate for 3 days, the typical 3-day food diary. And she just wanted to see if there was a relationship between how well they ate in terms of healthy food and what they were feeling like. So she was monitoring their mood for each of those 3 days. And I didn't think she'd find anything. She, as with any PhD thesis, there were a number of different questions. This wasn't her major hypothesis, but it was one of them. And she said, no, this is important. I want to do this. And I said, it's likely to be, no result in 3 days. And I was wrong, and she was right. And there was a very significant correlation between how those people were eating each day and their overall level. I think it was the GAF, general level of functioning. So that's a very, very good illustration of it.
Yeah, that's incredible. And in just 3 days.
Yes.
That's impressive.
But, let me comment on the 3-day thing.
Mhm.
I shouldn't have been surprised because I'm always telling people, look, there are things that we have to consume, especially to build our brains, and then others we have to consume so that they are metabolizing everything properly and synthesizing things and breaking them down, etc. One is more structural, one is more dynamic, functional, but there's overlap because many of the nutrients serve both purposes. But a good comparison one is omega-3 fatty acids are a little more important because they're in the cell wall. They may be a little more important in the structure aspects. And vitamins and minerals like the B vitamins, which we consume, they are cofactors for metabolic steps. And then when we're done with them, we pee them out. If there's a surplus, that's a little more functional, okay? And so why wouldn't how people were eating? I mean, when I say functional, it's like within hours it can reach your brain. I mean, one of the companies in Alberta now makes a sublingual broad spectrum formula. So it gets into the bloodstream very fast and skips everything that you can hold in your mouth, skips the gut and possible problems with your gut microbiome. And it goes directly into the bloodstream and directly into the brain and elsewhere in the body, but preferentially to the brain. That would be a matter of hours. And when I look at the people, the children who've been in various studies or just observational, whatever, I do know of several who showed some benefit from taking micronutrients in 24 to 36 hours. That shouldn't be surprising.
That's true. It shouldn't be surprising, but I had never thought about it that way. You always think about things being in the long term, but those are very short term and quick and important results.
They are. Yeah.
So, shifting a little bit to talking about or continuing the conversation on macronutrients and mental health. I know you've published extensively on the biological basis of developmental disorders. Can you explain how micronutrients like vitamins and minerals contribute to brain function and mental health?
Sure. So the most typical, there are a number of things that the micronutrients do, but the kind of dominant one that we are not being taught enough is metabolism and how the vitamins and minerals are the cofactors in every single metabolic step that I've ever seen in the brain. And I often will ask physiologists, do you know of anywhere micronutrients? By the way, I'm using the word micronutrient because it's shorter than saying vitamins and minerals. Okay, but that's how we use it. So I asked physiologists, can you name any metabolic step which is not enzymatic and does not require cofactors such as minerals and vitamins? And I haven't gotten an answer yet. So I guess I'm on pretty safe ground to say that this is a really dominant feature of how we have to feed our brain. Because now let me just step back and say, you can pick any place in the brain, any neurotransmitter. It can be serotonin, dopamine, acetylcholine, whatever, and find enzymatic steps where chemical A has to be converted to chemical B. Every one of those requires an abundant supply of cofactors. So that answers your question most directly. That's something that it's basic physiology. It's not mystical or flaky, or it's just the way we work, and you'll find it in any textbook.
So then which specific micronutrients are the most important for brain health, do you think?
The most important thing to ask me is never a question with the word specific. So, and I tell my friends, I mentioned this in the talk. I still have friends who say, Bonnie, which specific nutrients should I be taking? Like, name one or two that I should be sure to take to make my brain healthy. And how do you answer something when the question is wrong? The question is wrong. Once you look at how you need, maybe 20 micronutrients for the cofactors in the tryptophan to serotonin pathway, and maybe 17 for the enzymatic reactions involved in the production of ATP, and another, 8 over here and 6 over here. You need them all. You
Okay.
don't there, and and we can't even educate funding agency scientific review committees as we try to, but not getting through to especially NIH. Not that that matters now since it's being devastated and destroyed, but people still cling to the idea that there's a magical one or two, and there isn't. We need them all.
Okay. And so in terms of needing them all, which is very good information for me to have, because I always think like thinking of vitamins, not micronutrients necessarily. It's like, oh, if I just take vitamin B12 and if I just take iron, then it'll be okay. But obviously, it's a whole host of different things. So, how do these many, many micronutrients support cognitive function and emotional well-being?
I wish I could answer the emotional well-being question, Sarah, because, and I'm not sure that I can, because I don't think we really know. What do we know about it? We know that you can take a lab rat and deprive it of iron and zinc, and it will be irritable, angry, and violent. But nobody's looked at whether say the B vitamins are also involved, or any other one. But we don't know what part of the brain is most affected. But we do know that deficiencies of micronutrients result in poor emotional control. And the way we know it mostly is by giving people with poor emotional control a broad spectrum formula. And it's amazing to see. It's amazing to see a child who's been having meltdowns, see that child start to get wound up and then just kind of get themselves under control. And parents have reported this to me, like we tell the story of Liam in the book, that they can see that he starts winding up, but now he takes charge of himself. That's self-regulation that has come out of a bottle of mineral and vitamin pills.
Wow.
Yeah.
That's really great to think about too, what those serve in our day-to-day life and our emotional regulation. And in a way, I know you can't make the connection, but I think it probably does speak to improvements in emotional well-being.
Yes. Yeah.
Thinking then about clinical practice and prevention, how can clinicians incorporate micronutrient considerations into mental health treatment plans?
That's a really great question. And more than that, it's a really important question, especially because I'm trying to get some changes in some mental health clinics right now. But even though a lot of the research data comes from studying nutrients in pill form, we are all food first people. We have to first educate people why they need to change. And this is something the clinicians can do, to talk about what nutrients do in brain function, why it's important for you to improve your diet. And by improve it, I mean move away from the ultra processed rubbish and have a more and more dominant whole food, healthy food approach. In the book, we often use the term Mediterranean style. And we don't promote a vegetarian lifestyle or vegan. if you do those things, you're doing them for other reasons, which I totally respect. But no matter what you're eating, with meat, without meat, just be sure that you're eating real food, not ultra processed food. So that's the first step. And if to be very concrete, I would like to see clinics teach these simple principles and then have people fill in some descriptions of what they're eating, and then use there's some workshop kinds of practices which are very useful. People tell me they get a lot out of it, where you look at what you ate, say for the last, well, let's say, don't tell me the truth, but let's make up a lunch that Sarah ate today, okay? So I don't want to embarrass you accidentally. So tell
I
me.
can tell you the truth if you want.
Okay, tell me the truth. What
I
did you have
ordered
for
an
lunch?
acai smoothie bowl. So it had granola, it had fresh fruits, it had a smoothie. Part of it was motivated by knowing that I'd be spending the afternoon learning about health.
Of course it did. I know people always eat better around me. Um, it's true. So, well, that's a really good example. There wouldn't be much to do. Could you give me an example of a less healthy lunch that you may have eaten?
Yeah. So let's see. Some days I might on campus grab, for example, a vegetarian burger or a veggie burger. So it's
Mhm.
got the bun, the cheese, the processed patty, because since it's a veggie patty, it is a processed soy patty.
Okay. Well, let's for the sake of argument, say that the cheese on it was also processed cheese. Suppose I were to say to you, take apart that burger that you ate and categorize each item according to whether it's level one whole food, like maybe maybe it's got a lettuce leaf on it,
Yeah.
okay, or level two, meaning moderately processed. Maybe, I don't know what would be on a burger, but something that had been frozen or canned, maybe some beans or something in the veggie burger,
Yeah.
um, or ultra processed. The only ultra processed thing that sounds like might have been in there probably would be maybe it had Cheese Whiz kind of craft, those fake
Yeah.
cheese things.
It
Okay.
probably does. It probably
Probably
does.
does. So then ask yourself, how could you improve the nature of that lunch? Well, assuming you had control over it, which you might not have, you would say you would use real cheese instead of the ultra processed one. And maybe you would improve the quality of the bread and get whole grain bread instead of it was probably on a white bun, right?
Yeah.
So there are things that you can do that's not a total transformation of your diet. Um, Now, how did we get into this little experiment with you? Then we would also have you keep track of how much you spend for food every day.
Mhm.
And then we would ask you to start with one or two things, and you would target them. Maybe you would say, I've got to quit drinking Coke. I know you don't drink Coca-Cola because you told me that, but let's say, let's say that you were drinking bottled sugary drinks. So we'd ask you to skip it every other day,
Yeah.
maybe, or cut out one per day or something like that, and continue monitoring how much you spend. Well, you would find that getting rid of ultra processed stuff actually can save you money, especially if you can plan on the weekends and make large pots of stews and so forth. Unfortunately, saving money by eating better seems to be affected a lot by your planning skills. And having worked and lived around people with autism and ADHD and impulsivity and who really cannot, they just can't plan their way out of a paper bag. Um, it's often, that's a real weakness. It's the prefrontal kinds of executive function. Yeah. But you have no problem with that, so you could work on
I
it.
I really do enjoy the way you approach recommendations. They're very practical and they're not this sort of dramatic, like pull all of these things out of your diet.
No, no.
It's here are these small changes you can make. With those kinds of things in mind, do you have other practical recommendations for patients?
Yeah, I do. I think it's really important that clinicians ensure that their patients not fail. because most people who are going to see clinicians already have a lot of negative self-talk and feel like failures. And so if you have a patient who comes to you and says, hey, I hear that the ketogenic diet or a gluten-free diet would maybe help me. Should I try those? Don't let them start there. Especially ketogenic can be a little harder to follow. And people fall off the whatever and they feel like failures. So don't let that be their first experiment with dietary change. Let it be small steps that are within their reach and move them toward healthier food. I call them specialty diets. You can do the specialty diets later experimentally. Maybe somebody wants to try one of these kinds of diets, and there's going to be more and more research out on the ketogenic diet. I know of some studies that are beginning to show some very positive results. The question is, can people sustain them, and stay healthy too? So anyway, so the practical tip is start with things that will make them feel successful because they'll be successful.
That's true. And I think also that piece of, I know at least personally, those successes in making progress towards something keep me on track, even if they're
Yeah.
little ones. Like you see those subtle differences, you're like, okay, I can do this.
Right. Absolutely.
So you touched
Yeah.
on the idea that nutrients can prevent conditions like dementia. Could you share more about this evidence and how it might influence preventative health strategies?
Sure. I'm not an expert in this area, but obviously I'm interested because it's, nutrition in the brain. There's a woman, she's since passed away, Martha Claire Morris from a university in Illinois, who did some epidemiological studies and then longitudinal studies. And she showed that she could predict, no, maybe that's too strong a word. She showed that dietary pattern was a risk factor for dementia. And then she showed that she could slow dementia in some people by improving their diets. And since that time, that work was mostly about 15, 20 years ago. Other people have done studies, including putting the nutrients in pill form. It's always easier to do a placebo then, right?
Yeah.
And so I mentioned in the talk earlier about VitaCog, the clinical trial done at University of Oxford, and that was a very powerful study. They evaluated a group, I never remember numbers, but a sizable number of adults who were seniors and who had early cognitive decline. And they did brain scans as well as serum levels of things and all kinds of cognitive testing. And then it was a fully randomized, fully blinded, placebo-controlled trial. And half the people for 2 years took daily B vitamins at a relatively high dose, but safe dose. And the other group got a placebo. And at the end of the 2 years, all their measures showed the difference. Not only did the group who got the B vitamins show less cognitive decline, but they also had less brain cell loss. Now, it's hard to accept, but when we're like around 30, we start losing brain cells. And so the older we are, the more likely our brains have shrunk a lot from the loss of those brain cells. And if you have dementia, they're shrinking even more and faster, I guess. So to say that they slowed brain atrophy it's amazing. There are some other studies too that have looked at dementia, but I think there is a universal acceptance that once the dementia is advanced, there is maybe not much you can do with nutrition. So perfect example, we should be looking at prevention as with mental health.
Absolutely. I think we're learning in most realms of life that prevention is so much better for us than trying to address something after the fact.
Yes.
Now, I imagine a lot of our listeners are tuning in to learn a little bit about things like gut health and prenatal nutrition. So, can you talk to me a little bit about the importance of the gut microbiome in mental health and what steps can be taken to promote gut health?
Sure. May I give you a little historical perspective on this one?
Please, yes.
I always think this is so fascinating. I remember in the 1980s seeing two or maybe even three surveys published from mental health clinics, which said that in these outpatient mental health clinics, we had begun to notice that everybody had upset stomachs. And so we did a little survey, and sure enough, the majority of people being seen in these outpatient clinics had gut complaints, which was not true of the general population. And in the discussion section, every one of those surveys interpreted the results like this: being depressed is really stressful. And so, that really upsets your stomach. Nobody was looking at the reverse causation, but except for some of us who are saying, well, functional medicine people were, but they weren't yet being recognized. So, but that's what psychiatry was saying was, oh, it's hard on your stomach to be depressed, it upsets your digestion. But in fact, the arrow goes the other way. It's very likely that people who have digestion problems are in fact experiencing problems in their brain as a result. And so everything that I've said about mental health and micronutrients is relevant here because I always say, if you go into your local grocery store, the produce department, their sign should say, get your prebiotics here. People glommed onto this stuff and started looking for probiotics. And I'm going to say something about the difference between prebiotics and probiotics for a moment, okay? It's kind of like prevention versus treatment, right? The problem with probiotics is you don't have any way of finding out really what your gut needs. What is it missing or whatever. It's much better to just feed your prebiotics, to eat your prebiotics, which especially mean all the produce, right? And especially fibrous kinds of things that crunch. And those kinds of produce or vegetables and fruit, they feed the healthy gut bugs. When you feed the healthy microbes, those healthy microbes will swamp the ones that you're trying to decrease. And they also improve the overall diversity of the microbes. And one of the things that has been found both in Dr. Rucklidge's work and Dr. Johnstone's work, so that's in 3 countries, is that people who take micronutrients have improved alpha and beta diversity in their gut microbiome. So we know that it's important to improve your gut function, and that will have spin-off effects on your brain. I'm not an expert in that area, so I'm not going to say anything more than that, if that's okay.
Yeah, absolutely.
You've got some other good questions here.
Yeah. So speaking of Dr. Rucklidge's work, I promise I'll get that right.
Yeah.
Recent research suggests that increased prenatal supplements can reduce perinatal mood and anxiety symptoms, as well as preterm births. Can you summarize the implications for prenatal care?
Yes, that's a very exciting set of studies. They call it Nutrimum, and what they have shown in a variety of publications in the last 12 months is that improving the prenatal supplementation helps mothers in terms of decreasing their mood and anxiety symptoms. Also results in much better birth outcomes, less preterm birth, which she estimated. She was speaking to an American audience recently and did a calculation on if you decreased preterm birth, comparable to what they found in their clinical trial, that you would save about $1 billion a year in the US. So there's much to be said about helping our healthcare system by decreasing NICU time, preterm birth, hemorrhaging, etc. And that's what's been shown with the micronutrients. I think in general, if you add her work to some other things on prenatal supplementation. Someone's got to recognize that our prenatal supplements are very lame. The people who put them together are they're still saying things like just eat a balanced diet, dairy, and you'll be fine. And that's not the case. You can help people by improving their diet. So let me just add one more thing. In this Nutrimum series of studies, they have evaluated the children now at age 1, and they're going to follow them up to age 5. And at age 1, what's fascinating to me is that all their measures related to mood regulation, emotional regulation, habituation to stimuli, etc., all of those favored the group getting micronutrients. And that is going to have spin-off effects, I think, on preventing mental health problems. We think. We'll see.
I think it sounds very promising.
Yeah.
I am curious. We keep going back to very practical recommendations. So with respect to these studies that you spoke about, are there practical recommendations you can recommend for those thinking about prenatal care?
Well, I think the practical thing, Julia said it really well in this lecture she gave in the States to an integrative psychiatry group that I listened to, which is, many women who go on to antidepressants in pregnancy, they need help. They need to be treated. But some of them really don't want to take medication. And now what their data show from New Zealand is that there's a really good option that the women can be given the micronutrients in pill form and the broad spectrum formulas. And they will probably be doing very fine and they'll probably do well for their babies. But some women may want to go on to medication. That's okay too.
Such good points. Now, to kind of wrap this all up and bring it together for the broader impacts or even thinking about future directions, in your view, how can clinicians better support patients with respect to nutrition knowledge?
That is a tough one. If the clinicians are psychiatrists, they don't want to hear it from PhDs. But we now have 2 psychiatrists in the US who have lectures online and have been teaching in 2 different integrative groups. And so the integrative programs at the Andrew Weil Center for Integrative Medicine and the one in Colorado, the Integrative Psychiatric Institute, I think it's called. So they can look up these people. I'll tell you their names. And they've published one review paper, which I'd be, from a clinician's point of view, I'd be happy to give that to anybody who wants it. And one of them has done lectures for the Psychopharmacology Institute that if anybody wanted to join, they could watch those lectures on clinical use of micronutrients. So the one is named Dr. Amelia Villagomez, and it's spelled just the way it sounds, Villagomez. And her colleague is Nosheen Ranjbar. Nosheen is Noshene. Ranjbar is Ranjbar. And they have worked together and trained together at the Andrew Weil Center for Integrative Medicine, and now Amelia's in Texas, and they're doing a lot to try to educate physicians.
That's great. I think I even need to look those up.
Okay.
So then going back a little bit to Dr. Rucklidge and your work, you co-authored The Better Brain with Professor Julia Rucklidge. What key messages would you like listeners to take away from your book and your research on nutrition and mental health?
I don't get asked that question very often, Sarah. So what is the key message of my book? Thank you for asking it. I guess it is that we are underappreciating the importance of nutrition as the foundation for our mental health, and everybody needs to learn more about that. Some psychiatrists, including the 2 that I just mentioned, just published a letter to the editor in the American Psychiatric Association newsletter, which is called Psych News. They were commenting on a previous letter or article by Dr. Marta Mudd, which was called Using Nutrition as a Therapeutic Modality. And we were all so excited that an APA psychiatric newsletter was addressing nutrition as a modality in psychiatry, but she never talked about micronutrients. So these psychiatrists that included Dr. Villagomez and Dr. Ranjbar, but also Dr. Jean Arnold at Ohio State, Dr. Charlie Popper at Harvard, and another psychiatrist from Ohio State. I won't try to pronounce her name right now. At any rate, I should be able to do that. Shasava Ripur. They pointed out that you had to, for a complete therapeutic approach, you needed to consider the micronutrients. And I think that maybe is part of our book. It's the message that we don't appreciate that when we eat, we're eating for our brains. And what we're eating has to matter every minute of every day, because that's feeding your brain, even when you're asleep. And you have to consider the broad spectrum micronutrients that you can maybe get from a diet in adequate amounts, or maybe with supplementation.
That is such an important message. Before we wrap up our conversation, are there any final thoughts you'd like to share, or anything I didn't ask?
Oh, I feel like I've been talking for 10 hours. I think that'll do it.
Sounds lovely. Well, it's been such an
Okay.
honor to chat with you today and to learn a lot more about nutrition and micronutrients for you. So I do appreciate your time very much.
It's nice meeting you, Sarah. Thanks very much.
Thank you.
Thanks for joining us on the Her Health podcast, transforming health for women and girls at risk. Remember, your health matters, and together we can make a difference. Until next time, remember to prioritize your health and well-being. For more resources and support on issues affecting girls, women, and gender-diverse people, visit our website at avatraining.ca. This is Dr. Nicole Letourneau. Thank you for listening.